Hi, Dr. Eric Balkavage, and welcome back for Thyroid Success Secret number 10. And today we're going to talk about thyroid binding globulin. In previous Thyroid Success Secrets, I talked to you quite a bit about autoimmune thyroid as the #1 cause of hypothyroid symptoms in the United States. However, there's some situations where somebody doesn't have an autoimmune thyroid condition, and yet they still have hypothyroid symptoms. And this is one of the cases when we see elevated levels of thyroid binding globulin. This is a person who's going to go to their primary care physician or an endocrinologist, and they're going to get a TSH, a T4, T3 levels done, and those tests are going to come back normal. And even if they went to somebody who's using a functional range, or the optimal range is what I talked about in Thyroid Success Secret number 1, their TSH and their T4 values may still be normal. And the reason that those values be normal, but yet they still have hypothyroid symptoms, is because of elevations of thyroid binding globulin. Now, thyroid binding globulin is like the taxi cab that carries the thyroid hormones around. And the problem occurs is when we have elevations of thyroid binding globulin, it binds the thyroid hormone, but it doesn't release it. There's so much thyroid binding globulin around that there isn't a need to kind of bind the thyroid hormone and dump it out to go back and get more thyroid hormone. So then the thyroid hormone never becomes unbound from the thyroid binding globulin. So if you never unbind it from the thyroid binding globulin, then you don't have thyroid hormone able to get into the individual cells, what we call free thyroid hormone. So thyroid binding globulin elevations are caused by increased estrogen. So blood sugar problems, taking hormones, taking birth control pills, even some of the cosmetics that women use can have estrogens in them and can increase the levels of thyroid binding globulin. We increase the levels of thyroid binding globulin. We don't have free T4 and free T3 available for the body to use, and the person starts to have hypothyroid symptoms, yet their primary care physician or an endocrinologist or even an alternative medicine doctor looks at just a TSH and a T4 and maybe a T3 and says there's nothing wrong with you. You have to do what's called a T3 uptake, which will really give us an idea of how much thyroid binding globulin is out there with this T3 uptake test. Unfortunately, most docs don't run a T3 uptake, so if you never run a T3 uptake, you'll never get a good idea if elevations of thyroid binding globulin are a problem. But if you have a female who's on birth control pills or on hormones, their TSH level is normal, their T4 levels are normal, and yet they still have hypothyroid symptoms, we have to look at elevations of thyroid binding globulin as a potential cause of your hyperthyroid symptoms. Now, one thing that you should also note is you can have an autoimmune thyroid condition and have a problem with thyroid binding globulin. You can have more than one hypothyroid pattern going on. So we not only want to identify if you're Hashimoto's by looking at antibodies, but we want to do the rest of the thyroid panel. So when I run a thyroid panel, we want to look at TSH, we want to look at total T4, total T3, free T4, free T3, free thyroxine index, T3 uptake, and the thyroid antibodies. So we want to run a pretty complete panel so we can get a really good idea of what's happening with thyroid physiology to help understand what pattern or patterns a person may be struggling with. So this is Thyroid Success Secret number 10, thyroid binding globulin. Stay tuned for next Thyroid Success Secret number 11.